Hi, this is Brent Graham. During the pandemic, I think most of us became quite familiar with the use of telemedicine because this was an imperative in order to be able to continue looking after our patients. However, now that the pandemic is waning, it appears increasingly likely that telemedicine is going to play a possibly permanent role in the way we interact with patients in the future, especially in some clinical settings. The lead article for the July issue of the journal looks at the preferences and concerns of surgeons about using telemedicine. The article was authored by some surgeons at the University of Texas at Austin, and I interviewed the senior author, Dr. David Ring, about this in the podcast. If you have an opportunity, I would really urge you to take a listen to this because not only did we discuss the findings of the article, which in themselves are not necessarily so shocking, although they do inform areas where telemedicine can be developed further. But I think the most important thing about our discussion was the nature, understanding the nature of telemedicine in general, what it means to patients and to surgeons. And personally, I learned quite a bit from talking to Dr. Ring about this, even though I have a lot of experience with telemedicine myself. In our review section this month, we have three articles. One brings us up to date on spinal cord injuries as they relate to the hand surgeon. A second article is on the use of neurophysiologic monitoring during brachial plexus surgery. And the third article, I think, is interesting to a broad spectrum of readers because it looks at the development of a survey attempting to gauge the interests and objectives of prospective hand surgery fellows. And I think that this is information we'd all like to have as we train the next generation of hand surgeons.